When should you see a fertility specialist when you're planning your pregnancy? I'm Dr. Anitha, fertility specialist working here at Motherhood Whitefield. So there are many couples who wonder when should they see a fertility specialist rather than a regular gynecologist. So it depends on the age. If you're less than 35 and have been trying for more than a year and still not able to conceive, or if your age is more than 35 and after 6 months also you're not able to conceive, it's better you see a fertility specialist. And if at all you're 40 and above, definitely you should see a fertility specialist before you plan your pregnancy to know your chances. And the other things that indicate or you should see a fertility specialist is when you're having irregular periods. It could be because of PCO or a low MH. Even then you can have irregular cycles. You're having very painful periods. It could be endometriosis, it could be fibroids, which you don't know, which is hindering your chance of pregnancy. The other the new thing that has come now is for fertility preservation, like oocyte preservation and sperm preservation, especially because of your lifestyle or you're wanting to continue with your career, but still you want to have a better chance of getting a natural pregnancy or having a IVF later on. It's better you plan now. So this time is utilized to check for your ovarian reserve, the sperm count, is it okay, and then the sperm or the oocyte is preserved. The other thing is, if at all you're going through cancer treatment, if there is time, it's always better to freeze your eggs and sperms before you start the treatment, because future the treatment itself may hinder or it may reduce your ovarian reserve and sperm count, and it can hinder the conception. The other things, like sometimes there are cases where they are able to conceive but they are not able to continue the pregnancy. When you're having recurrent miscarriages, it's better to see a fertility specialist to know what is the cause, what can be done for that. And the other thing I would say is genetics. Sometimes there are certain genetic diseases which can be transmitted to the offspring. So when you know there is a genetic disease, it's better you always have a genetic counseling and also seek a fertility specialist to know how good it is to have a natural pregnancy. And then you can always check for the genetic disease, or before you conceive, it's better to know what is the genetic testing is done to see if the embryo what is formed is also having the same genetic disease, so that you can avoid in the future pregnancies. So these are few things that require you to see a fertility specialist. It's always better to go early than late, so that the stress and the level of the treatment differs if you've already done these consultations.